Well, good morning, everybody. Today is Monday, February 3rd, 2025. We are convened today as the Board of Social Services, and I'm Kristen Stevens, Chair of the Board of County Commissioners. With me is Commissioner John Kafalis, and Commissioner Shattuck McNally is on the telephone this morning. I think will be joining us in person. Is that right, Commissioner?
I'm going to slowly crawl that way, yes.
Okay, sounds great. And we have our Assistant County Manager, Lori Cadridge, with us this morning. And should I kick it? You want to get going with things or no? Okay, I will kick it over to our Human Services Director, Heather O'Hare. We have a host of people with him. I'll let folks introduce yourselves as you speak, and welcome everyone.
Good morning. Thank you. As Commissioner Stevens said, Heather O'Hare, Human Services Director. I am going to have my team do quick introductions just because today's going to be a bit more dialogue and it might be confusing to do them as they speak. So Thad, if you want to start.
Good morning, Thad Paul, Division Manager, Child, Youth, and Family.
Good morning, Vanessa Fuel, Division Manager, Benefits and Community Support Division.
Good morning, Lori Metz, Aging and Adult Services Division Manager.
Good morning, Kayleen Rowley, Business Operations Coordinator.
Good morning, Jill Mosh, Division Manager, Administration, Communication, and Excellence.
All right, thank you. So you have a packet before you. It was posted online as well. We didn't post the finance report just yet because we were pulling it at the end of last week, trying to get all of the information out of the state databases. So we'll get that included with the minutes. But before I jump in, just wanted to see if there are any additions to the agenda.
I don't have any commissioners. Do you have any additions? I don't believe so.
Okay. I did want to just touch on, there's a JBC meeting this afternoon that I think you were all looped into late last week, so I want to touch on that, but that's the only addition I have. But if it's okay with you, I actually wanted to, I had a bit of a light bulb moment this morning as I was walking in, and would like to take a different approach to the agenda than what you have in front of you. What I thought might be really helpful is to walk through the finance report, but then also side by side highlight the activity report that shows the workload, the caseload as it relates to those allocations. So as we're walking through to cover an allocation that's in the finance report, there are pieces in the department activity report that we might just touch on to help highlight why it's driving expenditures one way or the other. So if that's okay with you, we're going to actually combine those two and start there.
That sounds great, and I think that helps give context to those numbers, so thank you.
Okay. So what we'll do, you have the finance report as one document and then the department activity report. So I've asked the division managers to point out the page in the activity report as we're going through, but Kayleen will also pull up the dashboard here too. So, and Commissioner Shattuck McNally, stop me if this is too confusing as you're listening in over the phone. But you can focus on the finance report. We'll walk through that and just highlight the workload pieces as we go along.
Thank you, Heather.
Cassidy, did you hear that? There's some somebody online, is that right? That feels like there's a bad echo.
Okay.
Any suggestions? Okay, thank you.
Yes.
Take just a brief pause here while we look into that. Okay. Well, we'll proceed, and I mean, maybe there's also the streaming option if people don't want to be on YouTube, right? Would there be a difference then? Would that be clearer potentially for people?
Yes.
Okay.
Comcast feed or on fctv.com
Okay.
at fctv.gov. You can live stream from that location as
Okay, so we would make that suggestion that anyone who's hearing the echo and is on YouTube, go to maybe that alternate channel and try, I guess it's not really a channel, but means of communication and try that. So sorry about that. All right, we'll proceed then.
Okay, so starting again with the finance report. So this is our mid-year update. So these are expenditures through December 31st of 2024, exactly 6 months into the state fiscal year. So starting with adult protective services. So at the mid-year point, the pieces I would point out, so the elder justice COVID funds are gone. We won't be receiving any additional funding. So this is the last report that will include that line on here, and then we'll take it off. The client services and the administrative funds, those are the two funding streams that are combined for our total allocation. And the client services are, they're not discretionary funding, but we stop authorizing services when that funding is gone. So we are about 68% spent on the client services funds, but we track that and we'll just look for other resources, other options when those funds are gone. But the biggest concern remains in the administrative line. We are, as of December, we're 66% spent on our allocation, where we would hope to be 50% spent. So we are projected to be close to 1.9 million spent at the end of the year on an allocation that's just over 1.4 million. So Adult Protective Services has been identified as a budget priority by CCI, as your association, the Human Service Directors. It's a line item that has not been increased much over the last several years, as we're then also seeing those caseloads, the costs to administer the program continue to increase. And that really is just our team of staff that pays for. So the two concerns with that. One, there really isn't a closeout process. There are very few counties that are underspent that would help us cover that. And then at the end of the state fiscal year, that will come from our department fund balance. It doesn't roll into another pot of funds. It goes straight to our fund balance. So I'm going to have Lori actually highlight on the department activity report the caseload that drives these expenditures.
Good morning, Lori Metz again, Aging Adult Services Division Manager. So this would be slide 4 in your packet, and also here live on our dashboard. So you'll see in quarter 4 of last year, we had 277 open cases for adult protection. We have 9 full-time caseworkers for this staff. We did reduce that by 1. It's probably been about 4 years when we added a second supervisor. The 10th caseworker position was not filled at that point. So we continue to see caseloads rise. Cases are getting a little more complex, are having to be held open a little bit longer as resources become a little more challenging to access in our community. Particularly along the long-term services and supports arena. So we're just seeing our staff having to keep things open a little bit longer, be a bit more creative on that side of things. So while I think the work essentially hasn't changed, but I think the challenges have become more apparent as to what people's needs are in our community.
Thank you. Questions? Commissioner, yeah, go ahead.
Thank you. Lori, can you comment a little bit on what you believe are contributing factors to cases being more complex?
Thank you for your question. I think a lot of it has to do with staffing in some of our, support service agencies here in our community. People are waiting longer to get services because there just isn't a lot of direct service providers. There's a lot of great agencies in our community, and ever since the pandemic, people have never really come back to that work and that side of things. So I think that's what we're seeing is that there just is not a lot of services for that piece.
Thank you. Commissioner Shattuck McNally, any questions?
None at this time, thank you.
All right.
Okay. So we will go to the next allocation to highlight is child welfare. So the table that you have in the report all rolls up to that total funding amount at the top. And by the end of the state fiscal year, so two pieces that I would highlight in the allocation in particular. There are different closeout processes for each of these lines, but they do all roll into the block, the child welfare regular / block line. And as a state, there are projected collectively as a state to be 24 to 27 million overspent at the end of this state fiscal year. So our spending is really not much different. We do anticipate being over between 3 and 4 million overspent at the end of this state fiscal year. And then we will need to make some decisions about TANF reserves, which is one pot that we might be able to use to cover it, or the remainder then would come from department fund balance. So the county staffing is a separate carve-out allocation that we are working very closely with the state to fund. That's a big driver of the spending is the staffing. And as the state has identified the number of caseworkers we're short and then tried to meet that need with the funding year over year, unfortunately, the State Department, the governor's budget for next year did not include any additional resources asked for that line. So really looking at the complexity in our child welfare spending, that it really is compiled of services directly to the community, as well as staffing, as well as our out-of-home or foster care expenditures. So Thad's going to highlight the out-of-home caseload and where we're seeing some changes that is driving the spending.
Good morning, Thad Paul, Division Manager, Child, Youth, and Family. So page 13 of the handout is the placement data. I'll let you get to that page. So the reason I wanted to highlight this is historically what the left side is the Larimer County snapshot of in-home versus out-of-home versus the rest of the state. And then the lower half is kind of congregate care versus family-like setting versus independent living. So the reason I wanted to highlight this is that we have seen a shift in Larimer County, and we have actually are more consistently and more on par with most other counties across the state on the use of out-of-home, as well as the lack of use of congregate care. So at some level, I think we set the stage many years ago on really low use of congregate care, and the rest of the state has moved down. So from a comparison perspective, we're not all that different than most every other county. Which is an interesting snapshot. The other component to add into this into the placement data is that we do have a new case type that came into legislation a few years ago, foster youth in transition. So this is the case type for kids that historically were in child welfare, and then they can come back and reopen into child welfare after the age of 18, and we serve them up to 21. And so we have about 25 kids on a daily average in that population as well. Some of those are just moving from their dependency and neglect court case where we have custody, and then we move into this voluntary case. But that 25 is a number that historically we did not serve very many of those, so that has changed some of our costs for out-of-home care, as well as some of our numbers, if you will, of out-of-home care. Another thing to highlight in this context is that we're still doing well in the congregate care setting, but the acuity of our kids is pretty substantial these days, and so even getting some of our lower family-like placement settings to take kids, we are paying substantially higher daily rates just to maintain their behaviors, and or we're having to send them out of state because we don't have a state provider that is willing to accept them. And just like every other county, there are kids that oftentimes end up in hospital stays because we don't have a placement. And that can be anywhere from $1,500 to $2,000 a day that we potentially are paying for the care of that child because we don't have a placement that will take them. And the hospital setting is not appropriate, obviously, but if you don't, it's better than our office is our perspective. So obviously all those drivers are pretty substantial drivers to our being way over budget. The other component is our service community, similar to what Lori was highlighting, is there's not like there was some gap in our community after COVID on the number of folks that were able to help and support families. and their cost to do business, our local nonprofits' cost to do business all went up. So all those costs did a pretty substantial jump over the last several years, and our allocation just has not kept up with those increasing costs, both in the out-of-home population as well as the in-home service population.
And that, just a point of clarification, the foster youth and transition caseload that you referenced is included in the independent living.
That's right.
So you can see the large 11 without Larimer County. So the other large 10 counties have roughly 8.4% caseload of that type, and we are quite a bit higher at 9.8%. So that is a new carve out that we are seeing different expenditures, different caseloads, and represented differently than the other 10 counties.
Questions? Okay, I think we're, okay.
Okay. So we are going to jump to child care assistance. So we've had a lot of conversations about the CCAP program. In the expenditure report, again, through December, our expenditures were just over 4.3 million of our $8.4 million allocation. We are projected to be 1.2 million over at the end of the state fiscal year. The state as a whole is now projected, it increases week over week as we get better and better data. So just in the last 2 weeks alone, the projections went from the state being 17 million over to now 24 million over. And it really is driven by the provider rate increase that went into effect October of last year. That is just the first of 3 phased increases. So we'll have another one this October and another one in October of 26. So we're watching not only our own projections very closely, but also the data that's available statewide as those projections are less and less of a guess, the better data we have as time goes on. We are a year into the freeze, so February 1st of 2024 is when we implemented a freeze. We have seen a 25% reduction in caseload over the first 10 months, so from February to December. There has been a 25% reduction in the caseload or the number of kids that we're serving. But again, we're still spending more because of that rate increase, and do anticipate being on a freeze probably for the next couple of years is our best guess. I know we've talked a lot about CCAP in the last couple of months. Any questions?
Commissioner, any questions?
Yes.
Go ahead, please, then.
On a scale of 1 to 10, 10 being most confident or optimistic regarding supplemental appropriations to cover the gap, and now the gap appears to be closer to 24 million, what number would you assign?
For my confidence level?
If that's a fair question.
So very confident, and maybe I can touch on the JBC testimony that I wanted to touch on too. So let me give that context and then I'll answer the confidence question. But in the Friday steering committee at CCI last week, now Commissioner Zenzinger, who was a member of the Joint Budget Committee until she switched over to being a county commissioner, had suggested that county commissioners and human service directors should go today, this afternoon, to testify before the JBC. The Joint Budget Committee, JBC, offers one time a year where they will entertain public testimony. And so she was suggesting that today would be a good opportunity for counties to go and share what the constraints and the challenges are, the impacts on families. And so there were a handful of counties, and I know through Shane's conversations with you, we had planned on going to testify and then heard over the weekend that really isn't the place for counties to go. That really is intended for Coloradans residents to go and share their voice as they don't have the opportunity to engage with the JBC. We have plenty of opportunity to engage with the JBC and have done so. And so we heard from Senator Kirkmeyer and some others on the JBC that county testimony wouldn't be appreciated, that they would rather hear from the residents on all things JBC. So we aren't, if it's okay with you all, we weren't planning to go and testify. It sounds like other counties are not either. And I had another phone call meeting with Senator Kirkmeyer first thing this morning, as we've been meeting with her almost weekly on all of these budget items. So the JBC staff member has done a lot of research and has also been discussing a supplemental herself as she's providing memos and more data to the JBC members. I don't know if it'll be a supplemental or if it will just come, and I forget what the actual bill is called, but there is a way for them to address it as part of the long bill. Outside of an emergency supplemental process. And so there are lots of conversations and a lot of data being provided to the JBC members on just how short are we, as there are lots of questions coming up about State Department fund balances and what are other pots of money that they may need to tap into to address some of these needs. So I am very confident that the JBC understands the issue, and also very confident that the state budget is going to be a real challenge this year. So how much will come as part of the process by the time the long bill is approved? I think we're still waiting to hear, but they do have the data that shows the state is 24 million, projected to be 24 million over. So there are a lot of conversations and just trying to figure out where that money comes from, and a lot of conversations also about the UPK budget. The letter that you all signed that we sent to the JBC members has been referenced a couple of times. Just the stark difference in the state funding that goes into CCAP versus the state funding that goes into UPK, and the impact on families in our community. So a lot more to come, but there are conversations this week. The supplemental process is happening this week. We might not hear about a CCAP supplemental this week because they're talking about whether it happens as part of the long bill and the logistics of the accounting.
Yes, please go ahead.
Thank you. So I didn't assign a number, but that is neither here nor there. You're expressing some level of confidence, so I appreciate that. Just regarding the long bill, which of course is the budget bill, the state budget bill, which typically gets introduced in March, I suppose another part of that process is an amendment to the long bill. Is that what folks are considering?
Either that or it might be a JBC bill itself. I'm not sure the
Okay.
mechanics that they'll decide on.
Just one final comment, just to switch gears for a moment to federal level advocacy. I met with all three of us met individually with our CD4 congresswoman, and my charge was to talk about child care and development funds, CCDBG, and all of that discretionary mandatory funding. And I think I was successful at conveying that, and maybe offline we could talk about whether or not there should be some kind of follow-up, because I think we planted some seeds with the congresswoman that this is why this is important, and maybe we need to follow up to see what they might be actually doing with that information.
Thank you, Commissioner.
Thank you. That'd be great. I know there are a lot of conversations happening with Nagoose and his staff. So we have asked, one specific request to the State Department is that we partner and figure out how strategically and collaboratively we can advocate to the federal level. So I do anticipate that will be part of the conversation coming to CCI here soon.
Could we have a conversation offline
Yes.
about the conversation that we had? I think it was constructive.
Yes, thank you.
Thank you.
Thank you. No, you're fine. Commissioner Shattuck McNally, any questions or comments? Okay, maybe not. Maybe she's switching from here to there. I just Yeah, I was able to see Senator Kirkmeyer at the CCI breakfast on Friday, and she was grateful for the conversations that she's had with you. I think that that's really helped her kind of hone in the asks that they have. And so just wanted to let you know that she sings your praises too. So, but, you know, I think that I really appreciate all of your advocacy at both the state and the federal level, because, you know, this is a year where we have to do that every year. And this year it's so crucial for them to understand, you know, what we're trying to deal with. So I appreciate that. And we're lucky to have Senator Kirkmeyer, who has been a county commissioner and understands the needs of human services, you know, more. I think that there's understanding amongst the JBC members, but I think in particular, she has that understanding. And also, becomes a year where, you know, there is money, and some of that money may have to switch to cover situations that are more crucial than others. I would say that's what CCI has looked at. I think that's what CCAT has looked at, is really how do we prioritize, you know, some of these situations where people are potentially really struggling versus, you know, maybe some other asks which are nice but not, you know, critical for honestly for survival for some folks. So, thank
Madam
you.
Chair?
Yeah, please
Madam
go
Chair?
ahead. Yes, Commissioner.
Thank you. Thank you for commenting. I had the same conversations you did at CCI at the state capitol and with some others, and as we were conversing with our state legislator, colleagues, and certainly trying to express our concern, and also just with others that really thoughtful, intentional steps need to be taken. I want to thank Heather and staff for their diligent and tireless efforts and conversations with their expertise for those that are. I think that hearing's today, or is it next week? I can't remember. But I just want to thank you all for the work you do, and for working for us in Larimer County, because you are invaluable with your facts, your data, your expertise, and just know, just look forward to what we can do to try to address this. Thank you. And thank you, Madam Chair.
Thank you, Commissioner. Okay.
Thank you. Okay, so we are going to switch to Temporary Assistance for Needy Families, or TANF, Colorado Works. So the mid-year spending, we are 53% spent towards our allocation. And the piece that I would note there is that we are we are so close to our allocation because unfortunately we've had to stop all discretionary spending. So within the TANF budget, and it is a mix of the basic cash assistance, the cash resources that go directly to the recipients. It's our case management expenditures on the administrative side to administer the program and help those recipients reduce barriers to employment. And then we have generally would have some supportive services where we're helping to we're able to provide some financial resources to reduce those barriers. The basic cash assistance and the case management piece are required. We aren't able to reduce expenditures, and the only place then that we can reduce those expenditures, unfortunately, is in the supportive services. So we have had to stop all supportive services and those resources out to the community since February of last year, which is what's helping us stay within allocation. So we're able to stay within budget, but there certainly is then the impact directly to our community. And just a reminder, our allocation was decreased 5% in this current state fiscal year because of the allocation formula and the methodology. So we will be getting Commissioner Stevens well up to speed on that here in the next couple of weeks as a new member of the Works Allocation Committee, making sure that you have all of that information and how our TANF allocation then impacts CCAP and child welfare and the other allocations. But that's really, we're unfortunately having to reduce those resources in order to stay within the budget.
questions? Commissioner Kafalos, go ahead.
In light of events at the federal level in the past week, have any services been paused as a result of the uncertainty regarding freezing of federal dollars?
Not directly. We should know today, the stay, my understanding, the stay is good through 5 p.m. today, so we should have more information from the state departments today. There are, I would say, some allocations or some programs are at greater risk than others. And so we're really trying to dig in to understand that. SNAP and Medicaid in particular have been called out as an exclusion. But even within that, there's nuance that we need clarity around because I don't believe the entire allocation has been excluded. So we're still watching very carefully, researching what we can on our end, through, our finance director, through the budget director, through county attorney, and then asking a lot of questions of the state departments every hour to see what they are aware of. But we should know more by the end of today, but we have not stopped spending on anything. And I'm hopeful that we won't have to, but there are some that we're watching closer.
Yeah, when we met with Congresswoman Boebert, we were asking, because there was a lot of questions at that time last week around what was being frozen, and I asked her specifically about SNAP and Medicaid, and she sounded like she felt like Medicaid was fine, but that she wasn't sure about SNAP. So that was interesting. But I think that, she had limited information, even she had limited information about what, that looked like. So, thank you for keeping track of it because I don't think it's easy. And there was a list of programs then, I think, that were, and that at least the New York Times had put out a listing of programs, and I didn't see those kind of programs on it. There were food programs on there, but it wasn't necessarily SNAP. It was more food, school programs, which, there again, any loss of food aid in our community is devastating, so.
Yes, and how the specific call outs so far have been the direct benefits to the individuals. So that would be great if those were excluded, and the administrative funds then that we draw down within that same program to continue administering the program. There are a lot of questions around the level of detail that they're excluding. So hopefully we will hear very soon. But we do have confirmation from all of the state departments that they have drawn down the funds that they need for the first quarter. And they are continuing to check several times a day to make sure that those reimbursement portals that they use between the State Department and the federal departments, that those aren't shut off. They had been early last week. So they are still open, but they're checking every day just to make sure that there aren't changes.
Thank you. I know that creates a lot of work, additional work for you, so I'm sorry that you have to do that. But it's good to be vigilant, right, and to know where we're at, so appreciate that.
Yes.
Commissioner Shattuck McNally, any questions on this issue?
Not at this time. Thank you for asking.
Okay. And then one thing, Heather, could you talk a little bit about, you said we had to stop all supportive services or discretionary funding in TANF. Can you explain what some of those services, maybe just what some of those services might look like and who would be the beneficiary of some of those services?
I'm actually going to ask Vanessa to speak to that.
Perfect. Vanessa, you may. And sorry, Commissioner Kafalos has to go to another meeting, so you'll just have me for a while. And Commissioner Shattuck McNally on the phone until she gets it.
I'm still here. I'll be there shortly. I can't come any faster. I apologize.
That's all right. We don't want you to rush. Vanessa, thank you.
Sure. Vanessa Fuel, again, Benefits and Community Support Division Manager. So the supportive services in TANF is an opportunity for us to provide payments for concrete supports for people who are receiving basic cash assistance. So things like housing assistance, transportation, sometimes clothing for their children. Our case managers work closely with the participants to assess their needs and then to make referrals as necessary, right? If there's other organizations that can provide those services, then we refer them there. But oftentimes we're working with families who are experiencing crisis, and having money available to be able to give them additional money to pay for things like housing and transportation is really, really valuable to those vulnerable families.
Yeah, I know, in talking to some people at some of the schools, I think that there's some young moms that maybe are beneficiaries, and obviously if you're a young mom, you don't have, and you're going to school, you don't necessarily have a way to be able to work and take care of a child and do some of that. So that I know that they were, they can obviously get some of that help to get through school and be able to do that, so. But other people in crisis would be getting that as well, so, okay, thank you.
And the TANF population is one population that new cases bypass the CCAP freeze. So that is the other piece for a new parent that might be coming on to TANF. They would still then be able to access CCAP with a freeze, whereas individuals who are not enrolled in TANF, the freeze unfortunately prevents them from getting CCAP as well.
Thank you, and yeah, you had provided me that information, when I had some peoples from the school reaching out, that was a good message to be able to give them, is that that's a way for them to still get those services and the childcare, which, there again, if you're going to school and maybe trying to hold down a job, you definitely need that help, so, thank you.
So that is a great segue to county administration. So we were, let me cover Community Services Block Grant first. So the Community Services Block Grant is, it runs on a calendar year. So we are spent to right where we would anticipate to be spent. So that one always looks a little bit lower as we're tracking the expenditures. And that is, we're able to use Community Services Block Grant in most cases to replace the TANF supportive services. So very similar mission and objective. It is to reduce poverty and has federal poverty levels that are set for eligibility. So we've been able to tap into that allocation as we've had to reduce the supportive services in Colorado Works. Moving to county administration. So our county administration, these are the dollars that we draw down from SNAP and Medicaid. So these are the administrative dollars. And when I was talking about the federal freeze, these are the ones that we don't have information yet if they are excluded or not, as SNAP and Medicaid have been called out as exclusions. So our allocation is a mix of county administrative dollars that we get from the State Department of Human Services for SNAP and county administration dollars that we get from Healthcare Policy and Financing for Medicaid. And then they mix the two together and give us one allocation. So we are overspent. We are projected to spend right around 11 million in this state fiscal year. Our allocation is 10.7. I would say that even though we are overspent, that is the lowest overspending we've seen in over 10 years. We've really been trying to, there's been a lot of advocacy to the State Department. Our county admin allocation has increased significantly over the last couple of years. And we are nowhere near overspent that most other counties are. So we will be about 400,000 overspent. That also comes from fund balance. So similar to adult protective services, it doesn't go to another pot, it goes straight to our fund balance. But the state as a whole is between 30 and 44 million projected to be overspent. So there are a lot of conversations with Senator Kirkmeyer and others on the JBC about the overspending in this program. And the workload has just skyrocketed. So I've asked Vanessa to highlight our SNAP caseloads and workload. That is exactly what drives it. This pays for staff. There's nothing else that comes out of this allocation. It pays for all of our eligibility staff in SNAP, Medicaid, and some of the other smaller public benefit programs. We're not able to use this funding for anything else. So this is probably the allocation that is the best apples to apples, if you will, of where our caseloads drive the expenditures. So Vanessa's going to show you what we're seeing in the SNAP caseloads.
Yeah, perfect. Thank you, Kayleen. So our SNAP, also known as food assistance caseload, you can see here the average caseload in Q4 was 18,715 cases. But in January, we did go over 19,000 cases, and that's record high. We've been seeing record high caseloads pretty steadily increase since 2021, and it had kind of leveled off a little bit in 2023, and then we've seen a pretty steady increase in 24 and then into January. Record high 19,000 cases. And those are households, right? Those are households. That's case number. Yeah. So there's multiple people in a case. So we watch this number closely because the way that it impacts the workload is people who are receiving food assistance have to do a redetermination, recertify roughly every 6 months. So that's a significant workload to keep people on the program while we continue to see people coming into the program. So while this pays for the administration, that's what those administrative pieces are. That also includes any changes that happen in a household. So if someone moves, if they add someone to their household, or someone leaves their household, they have to report all those changes. And then we have to go into the system, do the data entry, and determine if their food benefit has changed in any way. So the administrative workload is significant the larger the caseload gets. We have more work to keep people on and to make sure that they're receiving accurate benefits.
Thank you for explaining that, because I think sometimes people look at administrative costs and have questions around how come they're so high, right? And so, but I mean, when you're managing services, and this is just the food assistance side for 19,000 families, I mean, that, I think that people can understand the magnitude of the, of the need, right, for people to administer those services, so.
Do you recall off the top of your head how many we have on Medicaid? Because that's it's more than double that number that are also on Medicaid, and with similar, going back through the case every year to make sure that they still qualify and have changes.
Yeah, so our Medicaid caseload is 38,555 cases. That was in January, so that's also not individuals, that's cases. Which you'll recall, with the end of the public health emergency, the folks that were on Medicaid throughout the public health emergency stayed on Medicaid. So we had 14 months as a state to unwind those who were no longer eligible and move them off so that they could go to the exchange or get private insurance in another way. Since then, we've mostly leveled out since looks like May of 2024, and then now we've just started to see it kind of slowly increase again. So that could be for a number of factors. People's health insurance changes typically when they change jobs. So if there's a change in, the economic picture, that can impact people who might be coming to Medicaid for insurance.
So, literally tens of thousands of, people are served by the folks that do the administering of these programs. Yeah. Thank you.
Okay. So moving on, Employment First. So Employment First is similar to Colorado Works, but it is the case management program for SNAP. So it's a very small but mighty team that help try to reduce those barriers for SNAP recipients. This allocation runs on a federal fiscal year, so that's why it shows we're only 13% spent. It just restarted October 1st. So, and this, I would say, Employment First is one of the most complicated allocations we have. It's 8 or 9 different funding streams rolled in to one. So we are constantly looking at how we can stretch those dollars as far as we possibly can. Unfortunately, it's an allocation that could benefit from a significant infusion even from the federal level, because reducing the barriers within poverty for our SNAP recipients is, it's a really significant gap. We're not able to do it as well as we possibly could because there's very little funding for this program statewide. And then moving on to the last one is the Office on Aging. So disregard the last column there in the table. The way those numbers are rolling up is not, they're not rolling up correctly because of the ARPA, the COVID money. So the bottom two lines there, the ARPA stimulus and the Aging Disability Resource Center Medicaid match, those are spent. So the ARPA funds, the COVID-related emergency money that the Office on Aging received, those funds are either entirely spent or have been allocated out to community partners. So those are one-time funds that we won't receive again. So it's that second line there that we watch the most closely, and that's just our ongoing allocation. So we are right on target to spend the allocation. If you'll recall, we've talked about the Office on Aging allocation quite a bit over the last year or so. We've had to make some really significant service reductions because this is an allocation that has already seen budget cuts at the state level and the loss of the COVID-related funding. So we've been doing a lot to right size within our allocation over the last year and a half, and do intend to, we'll be right at or just barely over our allocation. And it does not sound like there will be additional resources next year. So we're just waiting to see where the allocation stabilizes going into state fiscal year 25-26. But we anticipate that it will likely be right around the same, just over 3 million. And the vast majority of that is allocated out to community partners that are providing different services to our older adults or to their family members that are helping to care for them. And here's the on for the caseload.
Of course. So this is on slide 5 in your packet, by the way. So what this graph shows us is on the voucher-based program side of things. So as you recall, we do separate how we deliver services into whether we fund those community partners directly to provide those services to those individuals in our community, or we use a voucher-based program that is managed within the Aging and Disability Resource team within the Office on Aging. So you'll see here in the last few quarters that things have remained pretty consistent. This is the fourth quarter, so that is when voucher payments are reimbursed to our clients. So that's always why it's high. It looks kind of strange because they get reimbursed twice a year, or I'm sorry, reimbursements are due twice a year in December and then again in June. So it gets a little thrown off with that piece. But I would just like to call out that we've been able to maintain a high level of service despite some of the challenges in our community when it comes to having those direct care providers. The in-home services piece, to give a kudos to our Office on Aging team, has been a challenge to maintain having providers that will work with us at the rate that we're able to reimburse them for. So that's something that we've been able to manage and maintain and not go to a wait list at this time. But I'm not really sure, as things kind of continue to evolve on a fiscal level, all indications that we're seeing right now from the State Unit on Aging is that funding will remain flat as it has for the last year or two on that side of things. We'll also be reviewing all of our voucher services as we move along. Not all voucher services are required to be administered per the Older Americans Act, while we do have other services that we are required to provide, such as legal assistance. So as money conversations continue, we'll continue to have those internally to see where to continue to have those funding sources be most targeted. Actually, I have a budget meeting at 2:30 today about the Office on Aging and all the older adult programs in the division, and we'll see where people are. And as Thad mentioned, what we're seeing is that we're able to provide our provide funding to those community partners, but because their cost of business is going up, they're asking for more, and we're not able to provide the full amount that they request. So it's making do with what we have.
Are there any conversations about this at the state level? Or, I mean, there, obviously folks are aware of the challenges that you have, but there's no movement to increase dollars in any kind of way. Even though our population is aging, I would say.
Absolutely. There isn't at this time. I know today's State Unit on Aging meeting is largely about the conversations that are happening at the federal level, particularly around the fact that the Older Americans Act maybe has not been renewed at the federal level currently. So that's where their focus is today.
Thank you. Welcome, Commissioner Shattuck McNally. All right. We were talking about Office on Aging. I don't know if there's any comments you want to, no. Okay. Thank you. Thank you, Lori.
So that wraps up the first agenda item, the finance report and the activity report. I don't know if you have any initial thoughts. Was it helpful to do them together? So we will do that moving forward and actually create one report so that you're not having to toggle back and forth between documents. We can combine them and keep them that way if it's helpful to connect those data points.
Commissioner, any thoughts on that?
I agree. It is kind of nice to have it together, and also, I think it helps share the complexities, but the interconnectedness and how important that is. So, well done. Thank you.
Yeah, I would agree. I think together is good, and one affects, clearly the caseloads affect how much money we're going to need to spend on these, and also inform why those numbers are so high. So I think that's valuable. Thank you.
Okay, so we will combine them. So you'll see that we bring it every February and August. So we always do February as the mid-year update, and then August, we always report out on where things landed through the closeout process at the end of the fiscal year, but then what our allocations are for the next year. But we can bring it any time that you'd want to see it as well. So we'll combine those into one report and present that to you again in August. So I've asked Vanessa to share, so as part of your budget decisions for the 25 budget, we're very grateful that you were able to provide some funding to continue on with a portion of the child welfare prevention. And we've also we've shared with you that we received a pretty sizable grant from the federal SNAP team to purchase a mobile office and look at how we increase access to SNAP. And our community services block grant that we just shared with you is really aimed at reducing barriers and reducing poverty in general. So I've asked Vanessa, as we have sort of these three offshoots of different funding streams, but all focused on the reduction of poverty and helping increase outreach and access to our services. We're pulling the three together to try to really leverage the resources in a more holistic way. And so I've asked Vanessa to give you an update on that work and what are some of the key details that we're looking at as we pull those three pieces together. And so you have a one-pager. The team has not yet decided what they want to call it. So we're just calling it the poverty, our poverty reduction and outreach approach. So Vanessa's going to walk you through that and just share where the team is at now, what they're planning on for the next couple of months. And then we're happy to bring this back as they continue to move the work forward.
Great. Thank you.
Thanks. So, as Heather mentioned, this is pulling together these three funding sources. And it is also, I think, a culmination of bringing together the strategic planning work that we did in our previous iteration of our strategic plan, where we had a committee of people working on outreach and access and really asking our community different communities across Larimer County, what they might need from the Department of Human Services. So we took that work from, I don't know, there were maybe 15 staff that participated on that strategic plan committee. We coupled that with the research that came from the Office on Aging, where they did a similar process of asking community members in different communities what they might be needing from the Department of Human Services, taking all of the invaluable lessons learned from that prevention team and the work that they have done. And then we spent time visioning as a leadership team. We went through a logic model process to really think about, if we put all these pieces together, what kind of impact are we really trying to achieve? So that led us to our vision statement to reduce poverty in Larimer County by providing accessible, client-centered resource navigation and case management services that empower individuals and families to navigate resources to move forward, move towards self-sufficiency. Big vision, and a team of right now 3 case managers. So with that, taking that big vision and really thinking about what this can look like, we're now refining all of those recommendations into tangible activities. So we really are focused on people experiencing poverty and ensuring equitable access and resourcing, navigating the resources within the department that we have. You hear of all of the different programs that we have, and at any entry point, we want to make sure that it doesn't matter which door you come in, you can have access across the board, because we know that we've got multi-generational families that might need services across any of our service delivery divisions. So it's really then challenging us to look differently at how we partner with each other and making sure that we're getting access to child welfare resources, as well as all of the public assistance programs and any aging services that a household might need. So the services that this team intends to offer are outreach services. So we want to really increase our presence at tabling events, outreach. Sometimes you'll see a homeless event, and making sure that we've got presence there. Something that also has happened with us in the past is 5 of us will show up and have different tables at a particular event. So really trying to streamline and leverage this team to be sort of that mobile front door, and leveraging our time as well. As we hear with our resources, our funding, our time is also a finite resource. So we want to be really mindful about how we're doing that. And then, because this team will be able to be in those locations, providing outreach at both events, but also in communities. They'll be able to go to, we're now setting up a partnership with the Poudre Library District to have someone in the Old Town Library. We're refining what that looks like, because different partners have different needs from us and things that they ask of us. So we're getting into more of the detail. We had those big bucket recommendations, but now what does that really look like in practice and in partnership with our community agencies? And then also, what does it look like in places where there maybe isn't an agency or a community partner that exists, which is the vision of the mobile office, to be able to be that spot where our staff can go and people can come and access us. So then, in addition to outreach, I mentioned connection into human services. So helping folks navigate, they may be interacting with someone who's currently receiving TANF, and they already have a case manager. But that outreach person is hearing a need that maybe that case manager didn't ever know about. So that worker can pass the baton internally to our department, to the place where they're already receiving services. We don't want to duplicate that effort. Or if they're receiving a case management service external to Larimer County, we want to pass that baton there. There's somebody here who's designated to support you. If they don't have that already in place, then this team can serve as that case management support until we get them passed to the next place. So we've kind of just defined that as 2 different tiers of case management. The first is really brief and solution focused. It might mean that family just has 1 or 2 things, but they need some support in getting to that next step. Might be, I've never been to the food bank. I don't know how that works. Can you help me understand that? And they'll help navigate that process, but that's all the family might need. And then we say, okay, let us know if you need anything else. However, some families need more intensive support. They may have said, I've tried to apply for benefits and I just don't get anywhere, or the application is confusing, this team can support them through the process. They can support them with housing applications, right? If they need maybe they need a bigger unit, or their lease is about to end, or their rent is going to go up, and they need some case management support around that might be a little bit longer, then those folks would be in that tier 2 case management. A little more intensive, there's more activities, but still specific. There's specific things that we're working on together. So we're really excited about being able to provide mobile services, culturally centered approach, with a culturally competent team. So this is, we have some staff that have moved from the child welfare prevention team over. We're very excited about the knowledge that they bring from that previous work that they're able to bring into this role. And they are, we do have bilingual staff on that team, bicultural staff on that team. And then, as I mentioned, really building that partnership with community partners. And we will be looking at the outcomes of this team through the lens of these program areas. So the SNAP outreach work and the outcomes from the Community Services Block Grant, those will be the initial data pieces that we'll be monitoring, with our goals of increasing access to resources, improving client navigation, and enhancing self-sufficiency, ultimately, right, being the goal. That's all I have
That's a
on
lot.
this. We're really excited about this, the amount of work and time that has gone into the planning, and really the deep thinking about how do we take all of those lessons learned from the child welfare prevention team and evolve that and expand it into a poverty reduction approach that really truly is prevention work. And that prevention is by providing the interventions of public assistance and navigation services. So I'm really excited about this team and happy to share more.
Thank you, Vanessa. Questions for Vanessa?
Just well done. The only question I have, and you said pass baton, is it kind of like a warm handoff? And is there any follow up after you do a warm handoff, just to make sure, in case there was a glitch, that you don't end up with those clients or those families back to square one, do you know what I'm saying, to kind of, does that make?
Yeah,
I'm
absolutely.
sorry, I'm just not sure if I'm clear, so forgive me.
Yeah, I think the warm handoff question is really an important one, right? It's not just writing down a referral on a piece of paper and saying, here you go. This team is already very skilled at sitting down and making phone calls together, doing those follow-ups. Even if they did give the phone number and said, okay, you're going to call tomorrow, I'm going to call you after to check in and see how that went. So that really is embedded in their current practice, that we expect to carry that practice forward, because they have identified, the staff that work with these families have identified that crucial piece, particularly working with people experiencing crisis. They might forget that they had a task. And so having someone that can follow up and support them in the process is key.
Thank you so much.
The team is also, so under Deb DeLuca Forsley's leadership on the prevention team, they were convening bi-weekly meetings with community partners to have some of those conversations too. If it's not directly tied to a referral, what are some of the other gaps that they could brainstorm different solutions to? So the team is continuing that, and the plan then is to also look and say, okay, here are all of the community partners we've had at the table from the lens of child welfare. Who do we need to bring to the table from aging and adult partners, from other, public libraries, thinking about the needs in Berthoud and the Estes Valley. And so how are we also broadening those partnerships to be able to have similar conversations on a monthly basis, to develop those relationships and be able to follow up with that community partner too, if it was the right referral, if there was something that they weren't able to address once the family got to them. So it's a warm handoff and trying to deepen those community partner relationships so that we're all collectively having a broader impact than we're able to in our individual silos.
Yeah, that's great work. I think it's easy to get overwhelmed, and so like having somebody that can help you navigate is really important. There's a lot of I often wish I had somebody that would remind me to make those phone calls about healthcare or whatever, right? I mean, we all know how easy it is, and especially if you're, you're struggling with poverty and don't know how you're going to pay the bills. I mean, some of that stuff can go by the wayside of, you're living day to day, and so really having somebody to help, I think, is really important. What kind of statistics are you seeing around helping? So, you said you're going to measure the outcomes. So, I mean, have you seen this work being done that you can see this, benefits where you truly are moving people out of poverty? I mean, is there backup? I mean, obviously these seem like good practices, but is there sort of proof that kind of intensive, case management works?
So, yes, and so we are, as Vanessa said, this is an ongoing evolution of the work that we were doing under the grant-funded child welfare prevention in particular. So the final report from CSU we should have here very soon. To be able to look and see, we know that it had an impact and that the work that team was doing was reducing the child welfare involvement for those families that they were serving by being able to connect them with other resources or help navigate something within the system so that they didn't have to come through child welfare. So as we think about, trying to evolve that work and expand it at the same time within the resources that we have. We're hoping to be able to take the data from the CSU evaluation and identify what are those really top priority ones that we need to make sure to preserve. We also have metrics that we've identified in the SNAP grant that we've committed to food and nutrition services, F&S at the federal level, that with those grant dollars, we will increase access to SNAP by this amount. And then we have the metrics of the community services block grant case management. So the team right now is at the point where they are trying to identify what are those top priorities that we need to make sure that we maintain moving forward. But in child welfare in particular, there was a reduction in referrals of those families coming to us because those warm handoffs or those community partner relationships provided a host of different front doors, if you will, for that family to go to when they needed help. It's broadening those support networks so that families don't feel like they just have one person in the community that can help them, whether that's us or somebody else. So we do have the outcome data from the child welfare grant that showed that impact, that we're hoping to then also identify other metrics that we will track so that we can answer that exact question within this broader lens. What is the impact as we're continuing to push on all of the different allocations at the state level? That they can't just fund us to keep our head above water. We have to figure out how to fund prevention across the board for older adults, for young families. We are not going to serve our communities better in the long run if we're not able to figure out how to tackle that. And we're hoping that this will provide another set of data points to state partners to make that case too.
Well, thank you. So there's a lot here. So obviously, not just reducing poverty, but reducing child welfare cases and probably adult welfare cases as well. So that in itself is a great outcome, right? And then thinking about how I just appreciate your creativity, all of you. In a space where we clearly have financial challenges, you're saying this work is still important. We're going to figure out how to fund this. We're going to figure out how to keep doing this work because we know that's the ultimate goal of all those programs, right, is to get people on their feet and self-sufficient and taking care of their families. And so I just thank you for doing that because I will say in that poverty simulation that we did, so eye-opening around how important it would be to have a case manager because, we did a poverty, when did we do that simulation? It was October?
November. Early November.
Okay, close.
Election day.
Oh, election, oh dear. Okay, well, that's why I don't remember that. But it was so eye-opening because, you need information to show that you qualify for a bus pass or, just some of the hurdles you have to jump through that you could see where people start being like, I can't do this. I don't understand this. I can't do this. I'm trying to feed my kids and hold down a job. And now I need to spend an hour here proving that I can qualify for that, or I go to this church that's supposed to have food, and guess what? They ran out. And so, and now I don't have transportation to get back home. So it was very eye-opening. So there again, thank you for doing this work. I really, really appreciate it. Commissioner, anything you want to add? No? Okay.
Thank you. Yes, we are certainly within challenging budget times, and it's still our job and our mission to make this easier for the families that are in day-to-day survival mode with their own budgets. So that is our task, and we're still maintaining our focus on that area for sure. And just to plant the seed, I think in next week's HEH work session, we will also share with you a new tool that we're implementing that this team will be very crucial in using, that will help explain to our community what benefits they might be eligible for before they try to figure out which hoops they have to jump through to access those. So just to plant that seed, we'll be talking with you about a new tool called My Friend Ben in the next couple of weeks that will also, I think, be really instrumental for our community as a whole. So that's a great segue to our very last agenda item. We are continuing to stay very focused on the science of hope as well. That as we're having to make all of these shifts and difficult decisions, continuing to support our staff and continuing to focus on that innovation and out-of-the-box thinking of how we support each other. So I'm going to turn it over to Jill. Her team has developed a fantastic hope dashboard that shows the data around the science of hope across our teams. And we're continuing to work with the University of Oklahoma to help us pull out specific data points and brainstorm strategies. So we will close with just giving you an update on the science of hope and walking you through this dashboard that you'll see moving into the future as well.
Thanks. Yeah, so first I'm going to orient you to the dashboard itself. Were they provided this ahead of time? Okay. So the first one is we're going to be looking at comparisons. So we released the HOPE survey in, I want to say it was November of 2024, but then a year prior to that, we released a HOPE survey. So this comparison data will show those people that took both surveys together so that we can compare the data between the two. So at the top of here, you'll see HOPE groups, which is your individual HOPE score. So that's the belief that tomorrow can be better than today, and that you have the pathways and the willpower to make it so. So that's the definition of what hope is. So you can be high, moderate, slight, or low hope, and those colors will be shown throughout the dashboard to indicate what level you're at. Collective hope is your hope at work. So how hopeful are you in working towards a future that is better? And then burnout groups, and that will show just high and low burnout according to groups. So first level, you'll see survey participation. So you'll see each of our divisions listed here. Overall, we had an increase in our individual hope scores by 1.1%, which is really awesome. You'll see that about 74.4% of all of our staff took the survey the second time. And then you see individual division scores at the top there. So BCS, so Benefits and Community Support and Child, Youth, and Family divisions went down just a little bit as far as their participation. So the next level down, you'll see individual hope score comparisons. So again, this is people that took the survey the first time and the second time. So if they only took it one, they're not included in these numbers. So overall, we saw that individual hope scores went up by 2.3 points, which is really great. You'll see that there's bars on each of the divisions, and that will show you where the hope score was in 2023 versus where it is at 2024. And then you see green arrows up and red arrows down, and that would, so for aging and adult services, you'll see 22 people's hope scores increased and 4 decreased. So you'll see just the range of information there. You'll see more movement in Benefits and Community Support and Children, Youth, and Family, mostly because those divisions are larger than the others. So, but overall, all of the divisions went up in their hope scores, which is really cool. If you want to hover over the did you know, so Rebecca Stage pulled together this dashboard, and she's our data person, and she's a statistician. So she loves running regression reports. So the probability of retaining employees increases by 2.1% for every point increase in one's 2024 HOPE score. So we obviously want to see HOPE scores increase so that we can retain employees. And that was something that was statistically relevant, which is awesome. Some other key functions of this is just to hover over the eye, and it gives you just more information about what information is provided in these comparisons, in case you forget. Next level down is average 2024 collective HOPE, which is your HOPE at work, and your average 2024 burnout score. So you'll see each of the divisions here, and then,
Do you have a question? Sorry to
go ahead.
stop you, Jill.
Go ahead and finish, but I do have a question.
Oh, okay, cool. So you'll see overall our collective HOPE is 37.9%, which is still high HOPE. And then the burnout is 8.8, and it's showing as red because it's right on that cusp, and we round up, and 9 is considered high burnout, and lower than that is low.
And the collective, so it's two different scales. There's an individual scale and then a collective scale that measures more of the team HOPE, and it's on a different scale. Do you recall? So 37.9 overall collective HOPE. The scale, I think, only goes up to 40.
Yeah, scroll back up to the top.
So
And
you can't,
yeah.
you can't compare them side by side because they are different rulers, if you will, different scales that it measures them on.
Which is why we tried to attach colors instead, right? So collective HOPE goes up to 48, whereas individual HOPE goes up to 64. So
So that was one of my questions, because I see, if you could scroll back down, the average collective HOPE and average burnout score. But then I see this score analysis, and I see this very low end, 18 people that looks like severe or pretty concerning burnout. And so I'm just wondering, can I compare the two scales, or are they just saying different things? Am I asking the right question there? Because I think they're telling two different things, or are they saying the same thing but different ways?
So they are measuring this a couple of different ways, but telling a collective story. The other piece that I would add, so this is the first time that 2024 was the first time that we did the collective HOPE and the burnout scale. And the reason that we added that, working with Dr. Angela Ferris from the University of Oklahoma, when she saw our individual HOPE scores in 23 and then again in 24, she was actually quite amazed at how high HOPE we were scoring as a department. And so this helps us narrow down into a much lower level of detail to say, okay, we have people that are showing up individually scoring really high, but how does that play out day to day within a team? And we know from our work with HR and from our work within our peer resources that staff are still burning out. So we added the collective HOPE and the burnout score to help us get to that lower level of detail. So this is just the first time that we have it, but we will continue to measure this using this as the baseline so that we can see how it tracks over time. And not surprising, we're seeing really high burnout scores in benefits and community support and child welfare. And I think if you go, there's another one where we isolate out managers as well. So maybe I'll let Jill walk through the rest of the dashboard, and then we can come back, because I think isolating out the managers shows another level of detail.
That's very helpful. Thank you.
do you want to hover over the did you know for the collective HOPE? So the average 2024 collective HOPE above 1. The did you know? Yeah. So statistical significance showed that the probability of retaining employees increases by 5.5% for every point increase for one's collective HOPE. So your HOPE at work, 1 point increase is 5.5 more % likely that you'll continue to be an employee. which is really an awesome number. Dr. Ferris was like, wow, that's great. Like, she compared it to like your body weight. You know, if you lost or gained 5.5%, you would be like, oh, that's a big increase. And so she's like, think about it that way when you think about this burnout score. And if you can do something to make someone stay longer and it's 5.5% more likely that you'll stay, then why wouldn't you?
Well, I think it's good to dig into it, right? Because it's easy to say we're more hopeful, so that's great. And digging into that there's still people experiencing burnout. Why is that? What does that look like to help those folks? I think that's good to not just you say, okay, we're done, we're good, we're getting better, right? I mean, it's like there's still, maybe you can't get everybody to that place, but how do you get most people to that place? Or how do you help those people who maybe are struggling more with their work to find that hope?
Great. So we'll go to the next tab. All the way at you might have to, yeah. So this is just looking at demographics. You might have to hit reconnect. The second survey that we sent out, we included demographic information inside so that we could kind of slice and dice data. And you'll see that the hope scale groups at the top are the same as the first tab that we looked at. Click on the demographics tab. You're good. Yeah, so the groups are the same at the top, so that information's the same, but we sliced and diced according to these demographics. So the first is gender. So you can see there were 326 employees that took the 2024 survey. And then you can see how they answered as far as female, male, or undisclosed or non-binary. We combined some scores because they were so low in number. We didn't want it to be identifying data, so that's why you see that those two are combined. But you'll see that like individual hope scores, collective hope scores, and burnout scores for each of those individual genders are called out here as well. If you hover over the did you know, this is not statistically significant, but it's an observable factor in the data set that employees who selected undisclosed or non-binary as their gender had on average an individual hope score that was about 4 points lower than employees that were other genders. So that was just an important note to add there that might explain some of the data differences between the groups. And you'll see that the burnout scores are also higher in that same category and in female as well. So then we did race and ethnicity. So you'll see the breakouts of what was answered in that survey as well. And we'll do a hover over that did you know for that race section too. So employees that selected multiracial as their race or ethnicity had on average a collective hope score that was approximately 5 points lower than those who selected a different race or ethnicity. So again, observable in the data, but not statistically significant. And then we looked at longevity, and we talked about all of these factors with Dr. Ferris, but longevity is one that's really interesting in that you consistently see in data that certain groups of people struggle at certain times, but then they kind of bounce back. So what this kind of shows is that the people that have been here the longest period of time are really hopeful, but then the people that are between 3 to 6 years kind of dip in their hope scores, and it's typical to see that kind of wave to go up and down with longevity. And then we sliced and diced with managers too. So this is one that we did break out by division. We did not break the others out by division because it's not really a contest. We just wanted to see the information. But the manager information, we felt like it was important to see it by division here too. So you can see individual hope scores, collective hope scores, and burnout scores according to division. Just with managers here. And again, you'll see higher burnout in benefits and community support and child, youth, and families too. So questions?
Questions, Commissioner?
That's very helpful. Thank you for that. And obviously, I'm sure you're going to tell me what's the next step using this, so I'll just won't answer that question. Thank you. No, I appreciate you diving into this, and certainly things we haven't thought of or looked at before, so I really appreciate it. Thank you.
Jill, I have a question about, so when you say observable but not statistically significant, does that mean that you focus any energy on folks that may fall into those demographics where they're maybe not as hopeful as others? Or do you feel like overall you don't necessarily need to do that work?
No, I think we'll still dig in, especially in those areas that are observable in data. It's just that the regression tool that she used to run the stats through didn't show any correlation between the data, but you could see it in the data source itself.
Yeah, I mean, I was glad to see that overall there aren't huge discrepancies, right? I mean, that would be really concerning if you saw, multiracial be, double, the amount of burnout or something like that. So, I mean, I think that it's pretty consistent across the board, which is nice to see. And I do think that longevity is fairly interesting, because I think you're right. There are peaks and valleys in your career, right? And we all have that point of which, like, maybe I want to do something different. I'm not feeling satisfied with my job. I'm not seeing forward progress, or whatever kind of things happen. I think those things happen in relationship too, whereas like, oh, we're happy now. Oh, we're not so happy now, right? And I mean, some of that is just human nature, I think. But, kind of knowing that people who stay around that clearly makes sense, that they do have that hopefulness. And then how do you get people over that gap of the 7-year itch or the 3-year, where people kind of get stuck. So, no, it's fascinating. It's a lot of data. I'm glad you walked us through it, because we did get this in advance, and then I was like looking at it last night, and I was like, that looks interesting, and I'm going to let somebody explain that to me. So the explanation was really great. Thank you. Lori, do you have anything to add to that?
I'm not sure if I have much of a voice today. I spent the weekend with hundreds of little kids in a fairgrounds, and I think I picked up something from there. At least I lost my voice. No, I just want to echo the thanks to the team, especially around innovation and thinking about delivering services in a different way to try and meet the needs of the people that are out there, because this is definitely a need in our community, in every community, and we can serve as a model for others as well. So thank you.
So I'm happy to just say what's next, to your point, Commissioner Shattuck McNally. So there are a couple of pieces that we do want to pull out and potentially add to a long-term dashboard. Looking at the longevity scores, we also know that it would be good to overlay sort of the promotional timeframes as well. So Dr. Ferris asked us, in that 3 to 6 year range, are you seeing a dip in the hope scores and increased burnout? Because that's when people are promoting into a manager role, which is going to completely upend potentially your hope and your resilience. So wanting to look at sort of the progression of tenure and what that looks like there. We also want to pull out our hope scores for our bilingual staff. Are we seeing greater burnout if we're expecting people to use 2 languages and doing this already really difficult work? And what does that look like compared to the other data points? And then the third piece is putting this side by side with the HR employee survey data to see where we're seeing patterns and trends in that data as well. So all of that, when we were before you in December and we shared our next iteration of the strategic plan, we talked about our new Hope Council. So we are implementing a long-term council of staff across the department. I think there's 13 staff that we've identified from all of the divisions, line staff, managers, the leadership team that will be on that Hope Council, who are going to take this data, our HR survey data, and dig in and decide what we're going to do with it. What do we want to is there more information we want to get about, why our managers in benefits and community support and child welfare have much higher burnout scores? What do we want to know more about it? How do we start to brainstorm solutions? So that team is coming together here in the next month to really dig in, familiarize themselves with these data points, and start to brainstorm solutions so that we can sustain this work moving forward and identify. Maybe it's new data, or maybe it's just a greater level of detail in the data that we have, so that we can continue to measure this and start to share out, what are we doing about it? What are we doing with this information? And what questions are we asking of ourselves? And then what solutions are we implementing and measuring to know that it's having an impact?
Thank you.
Commissioner?
Yes.
If I might ask Heather, it'd be interesting if you look at your managers group and overlay the longevity to see what stage of their career they're in, because I could see some parallels happening there.
Yes, I agree. I think the length of tenure, but also as we've implemented the science of hope, I think we heard from managers who said, this is completely different how I was trained. I was trained just to look at the technical data. Are you getting your work done? Great, then that's where my scope ends. And so we're asking, I think, different things and new expectations of our managers to also balance that support for staff. And so we are identifying, I think, additional training and leadership support that our managers need to be able to support staff differently. And if our managers are burnt out, that support and training for them has to look different too. So that's the level of insight that I think this is giving to us as a leadership team, knowing that we're asking new or different expectations of our managers. That's then going to help us figure out what that development plan is for them to be able to move this forward.
Thank you. So you are all done. Are you all done then? Wow.
That is
We covered
it
a lot
for
of
today.
information. That was
a
great.
lot.
No, it was very helpful. So we discussed the JBC meeting, so we don't need to discuss that. That was the only other business we thought we might have, and we wrapped that into earlier conversations. So
Yes.
with nothing else on our agenda, we are adjourned at 11:31. Thank you.
Thank you.